Welcome to selfdiscoverywisdom.com, formerly known as Self-Discovery Media. On these podcasts, you're going to hear people who speak from the heart. They've taken the journey in life. Many things have happened to them, but they've changed it to happening for them. And in their strength, their courage, they've discovered their abilities and their wisdom, and they are now sharing it here with you. Do enjoy each show. We bring it to you with love and knowing that it's going to help you on your journey of life. Good morning, good afternoon, and good evening, everybody. Welcome back to another edition of Mental Health Awareness right here on selfdiscoverywisdom.com. I'm your host, Sarah Troy, and my guest is Paul D. Corona, MD. And what are we going to be talking about today? No one size fits all in mental health. We're going to be talking about his book, The Corona Protocol. He says the Corona Protocol is a scientific, proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicides 30 years in the making. And it's available in print, ebook, and audiobook formats, which we're going to be discussing more later. So he is a Southern Californian-based physician who is reshaping the future of psychiatry and family medicine. With over 30 years of medical experience, Dr. Corona is not your typical physician. Starting his career in family medicine, he seamlessly transitioned into psychiatry, ultimately pioneering the approach of mind and body healing. He is author of 3 books, Mind and Body Healing, a series offering revolutionary insights into the treatment of mental health and challenging conventional methods that have been stagnant for decades. How you tired of the one-size-fits-all medical solution? He offers an unconventional yet tried-and-true approach to psychiatry, which includes the off-label of medications, combined treatment methods, aggressive strategies to get results. Above all, he believes that mental health treatment is not about a quick fix, but about carefully collaborating balance that leads to holistic healing. And in this insightful interview, we're going to be talking about what makes his treatment methods revolutionary in the form of psychiatry, offering a refreshing divergence into a traditional models, and really looking at his mind-body practice medicine and the holistic approach that acknowledges the profound interconnection between physical health and mental well-being. So there's a lot here to unpack, but really I think one of the big problems that we look at in traditional medicine is they take a part of somebody, right? A part of what they are and not the whole of what they are. And, anybody that's in mental distress is going to be in physical stress and vice versa. And we have environmental stress, we have social stress, we have DNA stress. And all of this starts breaking the mind down and causing dis-ease within the body, which ultimately leads to disease as well. So welcome to the show.
Thank you. It's great to be on with you.
This subject is, as I said, one that's very, very apropos to now. There is, again, not one size that fits all. There isn't, you're depressed or you're anxious, take a pill. We have to really teach people how to navigate, right? And, what holistic practices one can use in order to use as your tools in navigating this path, because there's no escaping stress, is there?
Exactly. I agree.
So what are these practices that you look at? What is your approach and why?
Well, it really starts back to my training and actually back to medical school, because I didn't know exactly what I wanted to do. I liked mental health. I liked OBGYN and pediatrics. And so I chose to be a family doctor because I thought it would be a good mixture of everything together. So that's why I chose for my training. I did a 3-year residency program in Los Angeles for family practice. And then I moved to Orange County, where I'm at now, in 1992, and I started practice. So what happened is back then, I was really already interested in mental health. At that time, we had 3 SSRIs, which is the serotonin medications, the Prozac, Zoloft, Paxil. Mm-hmm. And I had okay results with certain people, but in 1993, when Effexor XR came out, which was the first SNRI, so it's the first one that was working on norepinephrine, not just serotonin, I was just floored at what I was seeing. I started to see people, their pain was getting better, the anxiety was getting better, not just the depression, and and we'll talk about off-label later, but yeah, I started seeing all these strange things happening. Fibromyalgia was improving, irritable bowel
Mm,
syndrome, and I thought it had to be this norepinephrine. And what really shocked me was, why am I not hearing about this? The company's not talking about it. Nobody's talking about it in the journals and the books. And so during the 1990s, I got so fascinated. I started really understanding the mind body issues that are going on, how stress affects the body. I think that why I saw it is because of being a family doctor and focusing on the
mm,
body. I was focusing on that. I think psychiatrists, they focus on the brain but not the body. So I think when
mm,
people come in with physical symptoms, they don't really look about it and think about it. They don't know what to do with it, really, frankly.
mm.
So I started to see I was doing things differently, and then I started understanding bipolar disorder, how to treat that, and I so during the 90s, it was really I was doing so much of this that I basically crowded out my family practice, and then about the year 2000 was when I decided to just break away from primary care and then moving into mental health full time, and because I really realized that I could make a bigger difference doing it. I thought, and I wasn't seeing, again, a decade later, still, I'm still not seeing other doctors doing things the way I'm doing it. And so that's what led me to writing my first book. So in 2002, I started writing Healing the Mind and Body, and that ended up being a 12-year journey of writing 3 books, 1,200 pages. So I eventually called them Healing the Mind and Body, the trilogy. And then I wrote 2 books after that that I'm currently working on, which are going to be training manuals for doctors, for primary care doctors especially. And then after that, I wrote my current book, The Corona Protocol. So it'll be by the end of the year, it'll be 6 books within 23 years of writing. And so it's just basically just a passion for the subject, and understanding this at a completely different level and way and still to this day, I still don't see other doctors writing about this, talking about it, the journals, the lectures, psychiatric textbooks that I've read, and don't read anything about this. And so it's revolutionary because I really had to kind of train myself how to do this, because I really didn't have a lot of guidance, and I just had to go by a feel and my gut instincts.
When you've got a doctor that sees a problem and decides not to stay in one lane and understand that there are many lanes, where does this lane start? Why does it branch off? Where does it go? And then understand that actually they're all of one lane. They're all kind of stem from the one. Why are they branching off? And, I have fibromyalgia. I've had it for 27 years. And we have a leading doctor here in Canada who I was his patient, and I interviewed him on the subject of fibromyalgia because you mentioned it, and of course it's one of those, what is fibromyalgia? And there's such an umbrella of conditions that are under it. Why are there so many? Where does it stem from? It's still a massive conversation out there because it's still a kind of elusive to really what it is. Oh, it's this, it's that. Just do this, just do that. And again, it may help one symptom, but is it helping the other? And, in mental health, we have to look, as we do with anything, what is the core problem? Because if you don't address the core problem, all you're doing is band-aiding.
Exactly. And I call it the Band-Aid approach of, taking pain pills, anti-inflammatories,
Mm-hmm,
relaxants, and so, but what again, I approach fibromyalgia differently, and I have really good results, because the core problem is neurochemically, is there's an imbalance in the nervous system.
mm-hmm,
And then what's unsatisfying to people is there's no test for it. You can't blood test it. You can't scan
mm-hmm,
it. It's all microscopically what's going on in the nervous system. And the way I use medications, so we call them psychotropic medications, and this is controversial because well, I'm not a pill person. I don't want to take a pill.
mm-hmm.
I want to take herbs and supplements. Well, those are pills. Uh,
Yes, yes.
so people are okay taking things if they're not a pharmaceutical product. Where in those, certain things can work okay, but they don't have the power of the psychotropic medications, like the antidepressants, the mood stabilizers. But you have to choose the right one, and
That's the
you
key.
have to choose, and it's also the right combination that you put together to get rid of these mystery illnesses like fibromyalgia and irritable bowel syndrome, and other things like chronic headaches and chronic back pain, and then when you go and they say, well, it's stress. Well, yeah, it's stress related, but then people say, okay, well, I live in a stressful world. I have a stressful life. What can I do about that? And so, but so there, I mean, there's ways of dealing it other than medications, like exercise and other
Mm-hmm.
is, but at the end of the day, when you understand what medications are doing, they're not dangerous, they're not addictive, and they're actually, I call it the most holistic approach because they're actually helping the body balance itself. They balance the neurochemicals that are out of balance, and the reason they go out of balance, you have no control over. You can't control genetics, which is the
Right.
reason that runs in families. You can't control your hormone changing like menopause, and
Hmm.
you can't control stressors in life like trauma and other things like that people go through. And so and then we live in a stressful world right now, and so
Yeah.
so when the doctor says, oh, it's just stress, well, yeah, with just stress, it's not just stress.
No.
It's people like poo poo it almost like, oh, it's not a big deal, just stop stressing out. And like, well, if it were that easy, I would do it, but it's just not that easy.
And quite honestly, underlying every disease out there comes from stress.
Right.
Right. And then when you get labeled with something, you become stressed about that. So stress is unavoidable. There is a certain amount of management we can do over stress, deep breathing or meditation, certain exercise, good foods, etc. But
Right.
again, going back to either chemical imbalance or as you talk that, like one of the things with fibromyalgia is that you constantly feel there's a current going through your body and like somebody turns the volume up and it's like this, and it never goes below a 5. And sometimes it goes really, really high. And to try and explain that to people, I know it's hard to walk because of this current going through your body. And even trying to explain it to doctors. And well, let's just try this drug or let's just try that drug. And it's like, I want you to know what drug you're giving me, that it's had results, that it really is addressing the problem and it isn't band-aiding it again. I don't want to be numbed out,
Right.
right?
Yeah.
I want to address what the problem is.
Right. And I think, like I said, numbing out sometimes that
Mm,
happens with SSRIs, especially people kind of feel apathetic and numb. And I like
mm,
what you said about the current. What you're feeling is your nervous system
yes,
moving,
screaming.
and it's an imbalance is what causes that feeling. And you're right. What you said before is it's a cyclical stress is a cyclical issue because stress, for example, causing chest pain, and people like
Mm,
think, okay, and then they end up going to the ER because they think I'm having a heart attack, and they say, oh no, we checked your heart out, everything's fine, it's just stress.
right.
Or I mean, the stress is causing headaches, maybe I have brain cancer, and that. So it's like the stress causes symptoms, the symptoms cause stress, the stress causes more symptoms. So this is a vicious cycle that's not broken until we break the stress cycle. And then once we're able to do that by again getting into your nervous system internally and fixing and because what medications do simply, well, to back it up a little bit, the nervous system is composed of over 100 billion neurons or nerve cells, and the chemicals are traveling around the system about 1,000 times every second. There's over 100 trillion connections between the cells in the body, so there's a lot going on microscopically. But the key issue is that there's leak. The medication, the chemicals are supposed to be going one way, not two ways. And the problem is they start leaking, the cell membranes start leaking and the chemicals start going the wrong way. And we call this neurochemical imbalances. So why did, again, that happens for the reasons I just said. And so what medications are simply doing is they're attaching to the nerve cell membrane and they're stopping the leak. So that's why I call myself a plumber. I just stop leaking. Um, and so what's happening is it restores that balance and it forces the chemicals to go the right way. And so when I do my job correctly, people say to me, I haven't felt this good in a long time. And, I
Mm,
felt this good since I was a kid. I haven't felt this good since I'm in my 20s. I haven't, you know what, doctor, I'm not really sure I've ever felt this good now that I'm thinking about it.
yes.
So that's my goal we call it remission. Remission is completely well, and it takes a little time, but not much time. I'm very quick at what I do, and I'm usually able to get people to remission within 2 or 3 visits, within maybe a couple, 1 or 2 months, even because of how quickly I move. And
Right. Well, as I said, I've been diagnosed 27 years ago, and I probably had it before then, right? And the whole umbrella that's there. And as I've aged, it's got worse. And the frustration of it is, I'm so tired of people, but just do this, and it's like, piss off. You know, don't you think I have tried that? And it's like come in my body for a day and then talk to me, right? And it's frustrating when you go to a doctor and they don't know what it is, and it's Prozac, it's this and that. And I do have Prozac for when my rabbit hole opens up, which hasn't in a long time because I've managed to put myself in a space where I don't allow it to, or I recognize when it's coming and I may go on it for a few days just to make sure. It's not that I'm anti-drug, it's that I'm anti the wrong drugs. And I've been through so many of them. And it's you get to a point where like, am I just taking these drugs for drugs' sake? Because nothing seems to be addressing. And that's the frustration we have as patients.
Well, have you ever been on Effects or Cymbalta or Prestige?
Sorry?
Have you ever been on either Effexor, Cymbalta, or Prestige?
Don't recognize those names.
You're on the wrong medication. Prozac is suboptimal because
Right.
because you really need to work on norepinephrine. So my favorite Prestige, Effexor is good, Cymbalta is good. So that's the first one on fibromyalgia. And then the second one, if it's not completely resolved with that, is adding a medication that works on GABA, like Topamax or gabapentin. So what I do with fibromyalgia is I start with Effexor or Prestige, and you see how far that gets us, which would be within a week. Believe it or not, it's going to work within a no more than a week, usually even a half a week. And then if it's 50% better, that's fine, but that's not good enough. I'm looking for 100%.
Mm-hmm.
And so then I would add something like Topamax if someone wants to lose weight. If they don't want to lose weight, I'll put them on gabapentin. Have you ever been on either gabapentin or Topamax?
Nope. Nope. Well,
You
I also had 7 years without a doctor. I'm here in Canada and we have a shortage of doctors. And the
yeah,
doctor I had before didn't quite know what to do with me either. So it's been a long time.
like don't. And if you want to be we'll talk about it later. If you want to be a patient, we can talk about after this.
Right.
Because I have a super high success rate with treating these mystery illnesses because I recognize the core issue, which is the imbalance, and most
Mm.
doctors don't understand it. And the problem with things like Prozac, SSRIs, is they make you feel apathetic and dull,
Yeah.
and so we don't. That's why I don't use a lot of them. I use a lot less of those. I mean, I believe that SNRIs, like Effexor was the first one. Now we have four out in the market. I recognize this for 32 years now that they're the best first line agents, and I've never read that in anywhere else. I'm the only doctor I've ever heard say that. I've never read about it. I haven't heard lecturing about it anywhere. So that was the basis of the beginning of my book, and is that first discovery that what's going on here, and why am I seeing this and no one else is that I know of, and that's what led to the books. Really, is that fascination, that curiosity. And then I knew that, there's a lot of people out there suffering needlessly that don't need to be suffering.
Yes.
So that,
Like this, we're talking about fibromyalgia, but when you are talking about the nervous system, it really is the nerve ending screaming, isn't it? So whether it's, the fiber optics of fibromyalgia, or whether it's, I mean, what is stress? Everything becomes like this and everything is overwhelming and you almost a shortness of breath. And it's like if the nervous system is just unable to cope. So it's the same approach with that as it would be with fibro.
oh yeah, absolutely. And then, like you said before, learning, like when you start to have the chest pressure and the breathing issue, just slowing down your breathing,
Mm-hmm.
deepening,
Mm-hmm.
deep breath in, just slow down and deepen your breathing. Or the other thing is go out, take a walk, because when you go and exercise, it forces you to breathe properly.
Mm.
Or if it's late night, you're not going to be walking around out there. Then you focus on the breathing, and meditation, yoga, all that stuff teaches that kind of breathing and relaxation techniques, and prayer, spiritual,
Mm-hmm.
meditate. We call it contemplative prayer. There's a lot of other things that people can do to learn to relax. And but yeah, but what's underappreciated is really the neurochemical part. And I think
Mm-hmm.
there's so many people out there, podcasters, influencers, who are very anti-medication. And unfortunately, like even like the biggest in the world, Joe Rogan and other podcasters are just they're I've heard him say, well, everyone has stress, and why do you have to take a pill for that? And everyone has to focus. So when I hear them and him and
It's dismissing people, isn't it?
very
Yeah.
dismissive,
Yeah.
and it makes people feel like, yeah, what's wrong with me? How come,
Yeah. Yeah.
then people already feel bad, and now you're going to make them feel worse, but now you're going to shame them, and to
Right.
go, yeah, what's wrong with you? Why are you complaining about something? Because everyone has stress. Well, everyone has stress for sure, but some people have less and some have more. Some people manage it better, some people don't manage it better. So it's an individual thing. But that's why with my approach, the Corona protocol approach is basically I really individualize things for each. I take a
Mm,
really good history. I spend a lot of time with people just metering out all the details. And then when I do something, I have them call me. I say, call me in a week. Call me in a week because within 1 week I can tell if I'm on the right track.
right.
And I keep in really close contact with my patients. I return every phone call same day. So I really focus on customer service. They know they can get a hold of me easily. And then and so then I usually, like I said, whatever I do the first, I often add a couple things together. Sometimes I'm patients are on two or three things. A lot of people are, but that's what it takes because I have to work on different chemicals, and it's not always just one or two chemicals.
And is that to correct the problem, or is that become to sustain?
Well, it's a good question. You can look at it either way. I mean, if it's a short-term issue, for example, let's say someone's had no problems, but then they lose a loved one and there's a devastating loss. Then they go into a really bad grief issue, and then and so sometimes, I mean, you can't really medicate grief. You have to go
Yeah.
through it.
Yes.
But sometimes if it's something that there's no history, and then you give them something, and maybe 6 to 12 months later, you take them off and they're fine. Now, if it's a more chronic issue, then people are going to be in them on there longer. But I look at it like this: look at diabetics on insulin. When
Yeah.
are they off their insulin? When is a thyroid patient going to go off their thyroid supplement? When is a so I, when do people go off their supplements? They never do. And so I
Right.
say, well, how about those supplements you've been off here? When are you going off those? Oh, I'm not going to go off the supplements. Why not? Well, because they're good for me. Oh, okay. So that's
Exactly.
implying that they're good for you. What I'm giving you is not good for you, which is
Yeah.
not true. So it's just about teaching people. And if people are on things longer term, see, when I get people to that state of well-being where they're feeling amazing, some of them say, I get it. I don't want to go off of these. If I can stay feeling like this, then keep me on them. Or some people do it on their own. They try it and they say try going off, and then it doesn't work out, and they go back on, and they check back with me, and I say, why did you go off? Well, I was just checking to see if I really needed it anymore
Yeah.
because I was feeling so good. And I go, well, okay, now the answer to the question, are you okay with staying on them? Yes, I'm okay now. So um,
Yeah, I remember back in the early 90s, a couple of mums I knew, and one of my daughter's school teachers, they were kind of on, I think, lithium and Prozac at the same time.
hmm,
And they felt so good, they came off them. And the next thing you know, they committed suicide, right? Three of them. And it was like, well, I feel so good. And then it was like the sugar high, the massive crash. And every single one of them, it was not a I'm going to do it tomorrow. I'm doing it right now. The baby's napping. I'm going to go and commit suicide, and it just kind of really put a huge warning out of those two drugs together. And also the false illusion. Well, I'm feeling okay. I must be okay. And that, the warning of you don't just come off something straight away.
right. Well, there's a myth. There's a myth that people have heard that antidepressants cause suicidal thinking or behaviors. It's really not true. And obviously it wasn't true that the crash. But the thing is, you would think, well, they crash after the Prozac's gone. Why don't you just go back on it? Obviously, it worked. Well, when you get into that mind frame and you're in that deep low, sometimes you can't think properly and just thinking, well, I don't want to have to take medication forever, so I'm going to kill myself.
And I
And
think it was because they were on lithium and Prozac. They were all on the double dose of things. And I think that's,
so they're
kind of
bipolar.
goes,
That means a bipolar
mm,
disorder. And so, when you're bipolar, you don't want to be stopping your medication.
no,
Usually with bipolar disorder, it's a lifelong treatment. And the only reason for suicidal thinking with an antidepressant is if someone's bipolar and it's not recognized. And so
yeah,
if you put someone into a manic state with an antidepressant, you need to either back up but then you have to add a mood stabilizer. An old school one is lithium, but there's newer ones that are even better. The more modern medications for mood stabilization. So usually it's a combination of antidepressant, one or two with one or two mood stabilizers for bipolar disorder. But yeah, but bipolar disorder definitely has a higher risk of suicide.
mhm,
I mean, the story I tell in my book about a patient who's actually based on a real patient of mine, the suicide chapter. If someone wants to read that chapter, it's a similar. She did really well on, but then when she went off, she did poorly and ended up, well, I don't want to ruin the story, but
Hmm.
what happened at the end. And so, so it's something that it's a very serious thing we have to take
Yes,
seriously because the potential if we don't take it seriously is death. The worst outcome with what I do is if someone kills themselves.
you're right.
And thankfully, my rate of that over 32 years of practice is extremely low because I communicate with patients. I say, look, don't stop. You're feeling good. Don't stop. If you're thinking about stopping, call me. I'll
Hmm.
I'll talk you out of it. At least,
And everything is about balance in life, isn't it? And what we've got to understand, we ask people to live a balanced lifestyle, but we've got to understand that balanced lifestyle, is helping us to keep the equilibrium within ourselves. And if ever I go down rabbit holes, I know my equilibrium is off, and I know how to recognize that now and what to do about it. But very often things happen that throw your equilibrium off altogether. And if you are on, even herbals or on the pharmaceutical, whatever you're on, whatever lifestyle that's agreeing with you, it's you want to keep onto it to maintain that balance, which is so very important because everything is about, with the teeter totter isn't about the highs and the lows, it's about the rhythm. And
yeah,
everything about us is rhythm, oxygen, our blood, our chi, everything has to be in a flow and in a rhythm. And we want to find that rhythm in our life and keep that flow going, keep that balance going. And we need to go prepared to go through the various things to discover what works for us. And I'm anti the pharmaceutical company push, 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 push drugs because it's all for profit. And also, obviously, in America, it literally is all for profit. What you can get elsewhere for
right.
10 is 1,000 over there, and it's just pure greed. And I think that's where the bad rappers come, is their greed. And the pushing of drugs before maybe checking them or just pushing it out of money is where the anti pharma has come in, right? And also the fact that farmers, that's the pharmaceuticals the only way instead of the balance with farmer FARM is see and the balance of nutritional and holistic. It really needs to find that balance hand in hand, isn't it, to have that good equilibrium?
Yeah, and again, I agree with you about pharmaceutical companies that just, and their, advertise on TV.
Yeah, which I'm sorry, it kills me. The one, depression hurts, and then it's 10 minutes of how the drug is going to cause suicide. That has just been mind blowing.
That's the government. That's the FDA, though. See, that's why. I mean, the FDA, the government's really why pharmaceutical companies can't talk real. That's why they can't talk off label, and because of the fact that that's illegal to talk off label, and then they get in huge trouble and get fined for
Can
it.
you explain what off label is?
So off label basically means using a medication for an indication that it wasn't originally intended to be used for. So for an
Mm,
example would be antidepressants.
mm,
Which I use, which is only indicated for depression, but I use them for anxiety. I use them for fibromyalgia. I use them for anxiety, stress issues. So I use them in different ways. That's all off label, and and so there's a lot of examples, but a lot of people call me doctor off label because I do it so much. But I'm able to tell people this is the real deal. Don't listen to the commercials. Don't go all those commercials. All the negativity is not true. It's all basically lawyers and government giving you medical advice, and just don't listen to it, and just turn off the commercial. Just don't watch it. And is there a profit motive in pharma? Of course there is. But the good thing that they've done is they've created some of these amazing tools for me to work with. Without them, I wouldn't have these magical medications to work with. And you mentioned, I think, Librium. I think a lot of people try to manage on like the Band-Aid medications, Xanax,
mm,
Librium, Valium, opiates, pain pills, and like I said, and that's just covering up symptoms
mm,
when you balance. But the best medications to balance the nervous system are the pharmaceuticals, and they work better than the herbs and supplements. And I call them holistic. Why? Because they help the body heal itself. They help balance the body system. Nothing else does that. You can go. I mean, yes, there's GABA, there's St. John wort, SAMI, 5-HTP. There's a lot of herbal supplements that try to do it. Do they work as well? Absolutely not. They're not all they're doing is adding chemicals. They're adding GABA, they're adding serotonin. That's not the problem. The problem is not a lack of chemicals; it's an imbalance of the chemicals.
Mm.
When you try to introduce more chemicals in the system, it might help temporarily, but it doesn't sustain. And so, and the problem is there's such an anti-pharmaceutical mentality out there. It holds a lot of people back because they won't even consider it if it's a pharmaceutical. And if they're stuck in that space and they never get out of it, they're never going to get better. They're going to live their whole life feeling poorly when they don't have to because they can't get past that whole pharmaceutical issue.
It's the same thing kind of with the vaccines. You look at the history, polio was stopped, and measles was stopped. Many other things were stopped. And of course, when, the coronavirus came out, it was, oh, can we trust these vaccines? They're being manufactured over 24 hours. And it's not true, actually. The research had been there. It was obviously getting it out there. And when you're doing it on such a mass scale, there will always be some people that will have a negative reaction, right? Because what else is going on in their body? But when we look at the diseases that have been eradicated today because of the vaccine, which unfortunately in your country has been revisited because of you have in charge. So, it's kind of a reminder that they do work. And the whole thing, why do we look at the research and the drug research is because they're trying to find, if the ethics is there, the cure or the maintaining or the getting to the root of the problem. That's why the research is there. But when it is misrepresented or interrupted, when science is interrupted, then what we see is you're not getting the facts and you will pay the price for it.
Yep. Yep, I agree.
So we're treading in vulnerable waters right now, and that clearly with what's going on in the world right now, the anxiety level is extremely high. And there are things that we can do: the breathing, the walking, Tai Chi, Qigong, yoga, going for a walk, being around your pets, being around your children, getting into laughter, finding a place to find joy. All of that will help quite considerably. But for anybody who has an underlying health condition, whether it's fibromyalgia, whether it's diabetes, whatever it is, all of that through the stress and anxiety is going to be exacerbated, isn't it?
Right. Absolutely. Yeah, and it's and all these things are, like I said, all these things are correctable, but people have to just understand that, that there's answers here. And if people are getting frustrated with the doctors, a lot of doctors don't know what to do. They have no idea.
No, no.
So, I don't need to just push my book. I wrote this book, the Corona Protocol. By the way, the virus they named after me. So that's how they came up with the name of the coronavirus. Uh,
I was wondering about the name.
but yeah, I think when in my current book, based on my current book is 30 original short stories about different people who have different struggles. And, so I talk about their struggles. I talk about their case. Some of them are based on real patients. Some are just my imagination. But then I go through my thinking process about medications with this person. So it's very detailed, and I try to make the medication part understandable to a layperson. So it's not really too complex. But if someone wants to really get a good idea how to tackle some of these things, like, because I mentioned all the things we mentioned today, fibromyalgia, all that. Then if you get to my book, I think you'll understand more. And then if it looks like, what, this sounds like me, I should do this. You go to your doctor and they don't know what to do. Well, maybe get your doctor one of the books and have them read it. They will.
Yes.
Or come and see me, or because I'd see I have a lot of patients all over the country that I talk to, and so I'm not sure how it works in Canada. If Canada will accept the prescription from America.
I don't think so, unless something has changed, but probably even less so at the present moment, in
Yeah.
case there's a tariff on it. So, yeah.
What I've done before with someone who's out of the country is I'd say, look, here's what I would do. I know the medications I work with are everywhere. I know we get a lot of stuff from Canada because we get cheaper medications from Canada, shipped to the US for people. But what I do is I say, here, look, you go to your doctor and tell them, here's what I would do, and
Hmm.
they can prescribe it, and then maybe I can kind of be on the side and kind of helping out, like, so if you check your doctor, call me back after they do this. I'll tell them what to do next. So sometimes that can work also if people are frustrated and they're not. A lot of people can't find a doctor that does this. Never
Right.
look, and even going to a psychiatrist. Do you think that would help? It
Mm.
might a little bit, but the psychiatrists don't understand at a very deep level the body. They don't understand the physical and the emotional,
Yeah.
and
No, there isn't the whole of you, and
right.
because of my condition, I've been sent to them, and all but one ended up on the couch, and I'm counseling them. So it's like it just seemed to turn that way. But the thing is that as a general doctor, there is so much information that you need to maintain. And actually, one of the shows I did a couple of weeks ago with Zamanim, he is a doctor that turned into um, creating an AI program for doctors on being able to do all the admin work, keep track of the drugs, do all of that to make doctors have freer time with their patients.
Yeah.
But if a doctor, and this is something I think that ego needs to step out of the way. I don't know what's causing this. I don't understand this. I need to be willing to do the research. And if a patient comes to you and saying, look, this person has dedicated their life to this, right? This is their channel. This is what you can learn from. If they say no, it's really time to question your doctor, because your doctor should know, I don't know it all. And I need to turn to the people that have honed in on this. This is their instrument,
Right.
right? Instead of me trying to know everything, let me go to the person that studied it and knows it.
This is why I've written. I've written two books already before this current one, but I'm working on them now. I'm editing them currently, and they should be out this year. I wrote these two books for doctors, and
Mm-hmm.
I want to teach. And what I'd love to do is do some traveling and speaking and
Mm-hmm.
lecturing and teaching. But yeah, what I call my fourth book is the Corona Protocol: Three Secrets to Success. And my fifth book is called the Corona Protocol Prescriber's Guide. I wrote them for doctors, but I also writing them so they would be understandable for patients, so that
Mm-hmm.
could maybe not
Empowering the patient to talk to the doctor. Yeah.
be basically preparing the patient to say, look, this makes total sense here. Can you do this? And
Mm-hmm.
here, let me show you this. Maybe let me leave it with you to read it, and then maybe I can come back later and get it. But yeah, I'm doing this so the patients can educate their doctors if doctors want to ignore it, because they shouldn't, because doctors need to step up here and take an active role with helping people. And if they are confused, they don't know what to do, well, they can learn. Any doctor can learn my methods. They're pretty easy to learn. And the way I explain them after doing this for like 33 years now is pretty. I've got it honed down to a pretty simple way of figuring it out too.
And that is the thing. It's rather like my doctor here with the fibromyalgia. I don't know if he has your book, and you could probably do with it. Um, that's the thing is because his wife had this, and he had to work out what it is she actually had, and then
Mhm.
he dedicated his entire practice to understanding it and how to recognize it in others. Because as you said, there's no blood test for it, right? And you've got so many other conditions that people are in. Never mind people that have gone through a trauma, and we've got to understand that trauma is passed on through the DNA. And
Mhm.
people understand, but why do I feel like this? This never happened to me. And that's the DNA trauma that's passed down through the family. And some traumas, you get over them to a point, but
Mhm.
they're still systemic there in your body. So, how do you kind of not suppress it, but make sure it doesn't take over? Because there are some people that have gone through some traumas that, however much mentally and emotionally to a point they've overcome,
Mhm.
it's still very much within their system because it's kind of in that cellular system there.
What you can do for trauma, is counseling and therapy when
Yeah.
needed. There's a specialized therapy called EMDR, which is the best type of therapy if you've had bad trauma issues, which can come from many, many sources. And the internal trauma you're talking about, the cellular trauma, really comes from the nervous system imbalances, which happen because of genetics.
Mm-hmm.
And so these are things that people can't help. People can't
Right.
help the trauma response in the body. And but are there things to do about it? Absolutely. We can take action here and do something about it rather than just just letting it be and suffering. There's so much suffering in this world
Yeah.
that's needless, and that's what's driven me over the years. Is I see it, I feel that suffering, and I hate it. I hate that people have to suffer like this needlessly, and then that's what I want to do everything about. I want to do everything I can to fix the situation, and I'm hoping with these two books that I hope they do well, and I can start doing seminars or
Right, exactly. Very much needed. I mean, you've got so many people in the fear zone right now. Or, people that are, oh, you're just neurotic like your mother, or you're just a highly stressed person, or, you're so sensitive. And we've got to understand that that is maybe something mentally that has happened to us, physically that has happened to us, but it also is still the screaming of the neurons, right? So if you calm those down, when whatever's happened to you has happened to you, you can deal with it more because not everything about you has been heightened.
right, exactly. Yeah,
So it's, kind of beyond, kind of diseases. It's also those conditions we just tell people to get over with or deal with. Isn't it about time you let that go? And it's like, I would love to, but how?
right.
And that's the thing.
And it belittles them and it
Mm,
makes them feel like, yeah, they're right. What's wrong with me? How come, yeah, my mom died or my brother died and my other siblings seem to be okay, and what's wrong with me that I can't get over it?
mhm.
And so they're beating themselves up because they're grieving and that
Yeah,
they're having a hard time getting through the grief, and that's all they have to not hear
yeah.
is being told that yeah, you're a weak person because you're not able to deal with somehow, and it's just it just makes them feel worse then, and it doesn't help the situation.
Do not tell somebody that's going through something or that's in a depression to snap out of it.
Snap out of
Please don't. Don't. It's so detrimental to them. It really is. So, I mean, there's a lot that we need to be aware of. I always say when you're aware, you care. When you care, you do something about it.
it.
And, I think the awareness that there are some people that are more sensitive within their personality trait. Um, I am asensitive. In other words, I'm a seer, I'm an empath, so I also pick up other things. Plus, I've got this, which is the screaming things going on in my body all the time. So I'm prone to that hypersensitivity. And sometimes it really does take a great deal to kind of try and switch that off and not hear and not see things and not react to things. And it's, it doesn't matter what people say to me. It is what I am, right? But having something that can manage those nerve endings so they're not screaming so much, where everything in my body can calm down, my mentality could cope with it. But what's not happening is my body is not coping with it.
Yeah, I'm very empathic too, and it's tough. I mean, being
Mm,
empathic is hard work,
yeah.
because to feel other people's feelings, and I do it all the time because I have to hear so many difficult stories
Yes.
and people suffering and crying in my office, and I have to take that in and feel it, and that's what's led me to this furious writing journey I've been on, is
Mm,
because it's like I feel it, I see it, and I feel that suffering that they're going through, and it's like I need to do something about it, and
yes.
yes, has it been difficult? Yeah, I mean it's not easy to write books,
I
you
know.
you have to be it takes a lot of time and dedication, and it's the writing is fun in a sense, it's the editing that's exhausting.
Yes. Yeah.
Uh, and on the books I'm doing now, I probably read them like maybe five times, and I'm going to read them probably a sixth time because I'm a perfectionist. I want to get them just right. And then people say, "Oh, just give it to your editor." I go, "I'm almost going to give it to my editor, but not quite yet because I have a little bit to do still, and I don't want to hand it off until I'm ready." And so it's tough because I mean I have a busy practice and I have to fit it in the evenings and weekends, and try to manage everything, which is not easy. But I'm doing it for a purpose. I'm doing it because I know when I'm done this year with these two books, I'm done writing for a while.
right?
This is gonna be a big burden off me.
One that then really what comes about is, as you said, the speaking gigs and the summits and the webinars to actually talking about what these books have been written for. You know, whom you could speak to doctors or just doctor importance, you could speak to patients and the
Right.
power because you know one of the things as a patient, and believe me, I know because I don't know how many times it's all in your head. I've had this all my life, right? Um, if having we go to a doctor and we want to talk about this and then you kind of somehow it feels intimidating and you don't end up addressing what you're feeling or again you know especially over here I finally got a doctor and he's obviously got to get to know what's going on but before I had the virtual doctors you were allowed 3 minutes and one question. Well, it hurts. Well, where does it hurt? All over. Well, how are they, you know, that what are
Yeah.
you going to be able to achieve in that time?
And that's
Right?
that's very difficult. I mean, 3 minutes and one question, really? I mean, that's just
Yeah.
outrageous to me. I
Yes.
mean, for a new patient, we talk it for an hour, and
Mm-hmm.
for follow up visits, I set aside 20 minutes. Sometimes it goes 30. So I'm not rushing people through. And then, going back to what with training, I've come up with like a revolutionary idea. I wanted to set up an online training course
Mm.
but I'm going to have like real patients that I'm going to see, like a new patient. So I take a history, and everyone else is on the line, and I go, any other questions for this person before they exit the scene? And then after they exit, okay, let's talk about what do you think? What's the diagnosis? What's the treatment plan? So basically, and then we'll do follow-up visits. So basically, an online clinic, basically. So I'm showing doctors exactly what I'm doing. I'm showing them my thinking process, why I make decisions I do. So I thought that would be a really practical way of training doctors
Yes.
is to do that. So that's that or seminars or all that. It would be
Well, both of them. And actually, you're being a Dr. Watson. I don't know if you've seen that show yet, Sherlock Holmes and Watson, but it is about the minds coming together, right? And like, this is what I've achieved, this is what I've done, but let's hear input from everyone else, or or questions from everyone else, because again, where do doctors they have the doctor conventions, but they've got to leave their patients, their families. This is something you can do online. They can
that's
set aside an hour or so and get so much more out of it and empower them to treat their patient better.
exactly. And then I would part of this is going to be doctors bringing cases to me, and they say
Yes.
the challenging case I can't figure out. So then we basically I talk to the patient, and we all talk together, and then I am able to to fix it by just showing, okay, this is what I would do, and it's teaching the doctors who are struggling with figuring out a patient. Look, here's what the answers are here, and then it's basically teaching in real time, and like you said, it's much more convenient not to have to
Yeah.
go to the seminar and leave the practice and all that.
Right.
And the other thing that is really exciting too. I'll talk maybe about when we exit is that I've been doing a TV show now for the last 6 or more months, so now we're in our third season of my TV shows. This is another way that is really reaching people
Good.
is the TV show.
How do people find that?
So the Dr. Paul show, so the Dr. Paul show, it's on Roku, which is over 7 million
Hmm.
worldwide. It's on Amazon Fire, which is like they say a Fire Stick, whatever that means, and it's on YouTube. So it's for on YouTube, you have to put, and it's over 20,000 views on YouTube, over 1,000 new ones a week. On YouTube, you have to put the Dr. Paul show, all lowercase, no spacing, no period. So it has to be all stuck together. THEDRPAULSHOW. So if you put that in just like that, then you see a free YouTube channel, and it's basically the show is what I'm talking about. It's talking to my patients and getting their story and getting their where they started, when they started seeing me, what the results have been. So they're basically the show is based on real life patients of mine and me basically explaining what I've done. And I have a whiteboard and then I explain the neurochemistry. And so basically teaching people, which is exactly what I want to do, which is why this show has been really fun to do. Again, a lot of work, but a lot of fun because it's really fun to hear people just raving about it, and they say just the stories are so compelling, and they give people hope because they people because I deal with a lot of difficult people on the show, severe addiction and
Hmm.
that I deal with. And when people see that they come out of that state, they're in the sobriety, they're better, they're not depressed anymore, and they see that what my treatments have done in real life actually because of using real people. So it's also been pretty interesting, and the reaction's been great.
So this is your podcast that people find on your site, right? Is that
Not, not a
leading to it?
it's not a podcast. I did a podcast for years, all like during the pandemic. I did a podcast for a while. This is a TV show, so
Okay.
yeah. So we're doing 16 episodes a season. We release two new shows a week. So right now we're in the middle of our third season. We've released about at least 40 shows already.
Excellent. So we'll put that link up on the show page. I also love your logo, which is a stethoscope around the brain, which is really, really cool. And when you talk about addictions, people don't grow up, I'm going to be addicted one day, right? Addiction comes about through trauma, through stress, through chemical imbalance, and this. Yes, sometimes it's some abstaining from life. Life is just too much overwhelming. And again, that is about those nerve endings that are screaming that people can't cope. So what do? They take the drugs to numb. And it's not just drugs. It's alcoholism, it's chocoholism, it's workaholism. It's people avoiding what the problem is. But if they don't have the right chemical balance in their body, they're never going to be able to address what the core problem is. All they're doing is, for whatever their addiction is band-aiding it again.
Yeah, and addiction is a brain disease, and it's a disease
Mm,
of the brain, and it's basically in so many words self-medicating. So
yeah,
people start self-medicating like with alcohol to de-stress at the end of the day, and then it becomes a habit, and then it's every night, not just occasionally on the weekend. So I mean, there's this difference between social drinking that people can do, and then more severe. And then yeah, the drugs. There's a lot of more drugs available now than there used to be in previous generations available. There's some really deadly ones like fentanyl, which is killing a lot of
oh,
Americans. Uh, and it's a bad scene out there with drugs. It's there's a lot of homeless people. There's a lot of people with most of the homeless, which we have a lot in California. It's mental illness and addiction,
yeah,
and you can't separate mental illness and addiction because they tie together.
yeah.
You can't find an addict that doesn't have mental health issue.
You also have very functioning addictive people, which I've interviewed many of them, even including the fentanyl. I was given fentanyl after an accident, and then I became addicted. Then it ended up being a gun under the pillow, and the
Yeah,
spiraling of it
right,
because it's such an addictive thing. But you have working alcoholics, you have working drug addicts, until it comes to a point where I call the cosmic 2x4, where
right.
whoosh, and no more. And now from those ashes, what are you going to address the problem? And sometimes it takes a few cosmic 2x4s for a few people to actually kind of register it, because their mind goes right back in to, oh, if I do this, I can avoid that. And a lot of it is we can't avoid, right? But you
Yeah.
can't face whatever the trauma is. You can't face what the disconnect is. You can't face what the problem is if the brain is out of balance.
Brain's out of balance, and if you don't fix it, they're going to fix it in any way they can,
Mm,
and then they fall into an addictive cycle. Yeah, you're right. There are functional alcoholics that
mm,
can drink but still hold down a job, and then they on the weekends they drink heavily when they're not working, and then they recover by Monday. And but yeah, it's a tough thing. Any addiction is very difficult. Nicotine is probably the most difficult of all. And
mm.
now they have vaping, which is so people can do it indoors. So now that's even worse because you used to be more like work breaks when you go outside. Because at least here in the U.S. we don't allow in
Yeah,
smoking.
here too.
So now with vaping, people say, "Oh, it's a safer alternative." Well,
Mm,
in certain ways, but the problem is it makes nicotine so much easier to obtain because now you got these fruity tooty flavors, and
mm.
people like the flavors of it and doing it inside when they're working. And then and nicotine is probably the most difficult to break of any addiction out there.
Right, yes. And the other thing about vaping is that literally it destroys the lungs, and it's a lung transplant, folks. It's not a repair. It
It's
cannot repair.
Yeah, the chemicals there, they're terrible for the lungs, and
Yes.
really popular among teenagers and
Mm.
adolescents here. And they can do it at school and get away with it because they'll do it in the room during
Mm.
school breaks and go into a stall and do it there and then hide it and so and then or vaping marijuana. There's a lot of that that's going on in the U.S.
Mm.
So it's yeah, it's a tough, and I deal a lot of the cases I have on my TV show are addiction, and if you want to look at Samantha's case, she's gotten a lot of attention, and to the point that the TV network wants us to do a documentary on her. Is they want us to do like a 3 hour documentary on her story of addiction. And so my videographer is gonna follow her different places where she was when she was homeless and talk to her parents and her friends. And so we're gonna put together like a really complete documentary on her.
I'm glad you're doing that because I've done many a show on that, and people were saying that hitting their rock bottom, they were fortunate enough to know they hit the rock bottom. They were
Right,
fortunate enough to wake up. I cannot go down this path anymore. I need help. I need to go and do something, where there
right,
are so many that aren't as fortunate
right.
because, they just take whatever they're taking one too many, and it's bye bye. So,
Yep.
um, when somebody, you can't help somebody until they're willing to help themselves, right? So they've got to be willing to come to you and willing to go down this path. As with anything in life, it's choice. But when people get to hear that there is a choice, I think most of the time people go to addiction because they feel helpless and hopeless because they don't believe there is an answer, right?
Yeah, and then whatever they're doing helps them feel better for the moment.
Yeah.
Problem is it wears off, and then you have to do it again, and you have to do it again. Especially fentanyl. I mean, it's hard to find heroin anymore in the U.S. because fentanyl's taken over, and
Yes.
we get it. China ships the ingredients to Mexico. Mexico it gets across the border. We get some coming from Canada. But fentanyl is a really difficult issue because the problem is it's extremely short acting, so you have to kind of keep doing it again and again.
Yeah.
And then like Samantha's case, she almost died 3 times of overdose, and so she
Mhm.
brought back by Narcan. But yeah, but she grew up in a very privileged house, and she was the only child, and her parents were wealthy, and but basically eventually they kicked her out because she was doing she wasn't following the rules and kept relapsing, and so yeah, so she almost died, and she's fortunate to be alive, and now she's doing great, and
Mm.
she's really happy to tell her story. She's really looking forward to it, which is great.
Life after fentanyl. And, that's for a
And
lot of people, they don't believe there is any life. This is it, right?
and methamphetamine is a huge issue too.
Hmm.
And there's a lot of meth going around, a lot of
Yes.
opiate.
Oh, but
Um,
meth is so horrible because it literally just changes the whole body. They can't stand up straight, right? You're
well,
like, is there any return from meth?
it burns out the brain, and
Yeah.
it basically creates holes in the brain, and
Mm.
so it got popular. Of course, this the very popular TV show Breaking Bad, and we kind of
Mm.
glorified it a bit in a sense, but it's gotten huge, and it's a very dangerous drug. It gets people psychotic, and then they do psychotic things, and then they're on methamphetamine and fentanyl, the combination, and one brings them up, one brings them down, and they kind of balance themselves out that way. But it's a destructive path, and that they go down.
And again, with the meth, with those holes in the brain, does the brain repair after that?
It,
Right.
it, it can, but some of the patients I've seen that have been most resistant to treatment is the people who've done a lot of meth. Because but yeah, the brain can repair for a lot of people, but sometimes it doesn't fully repair when you've damaged it too much.
Right.
And then you have to, they get so much better, but sometimes not as fully better as people who didn't do that so much.
Right. And that's a brain injury. My daughter works with people with brain injury, and, we can get brain injury from accidents, from strokes, from that. But, people don't think about it as from drugs,
Right,
right? And it's, you are literally frying your brain,
right,
right? You've put it in a frying pan. And again, people don't go, well, I am going to do that. This sounds exciting. I want to go and be a drug addict. It becomes something that everything becomes overwhelming, or it's like want to be part of the cool crowd,
right.
and I can manage it, just like people. I can manage my drink. I can take one more, and but the more you take, the more you start losing that sensibility and that control of choice. And next thing you know, you're over there.
Yeah. Yeah, a
So,
lot of that, you said the cool crowd, where they were,
yeah,
a lot of parents would say the bad or the wrong crowd,
right.
hanging around, kids that aren't good influences, and then they all kind of, and bad influence on each other, and there's a lot of that going on, So having really good attentive parents helps for sure.
Yes.
Knowing what your kids are, where they are, what they're doing, but you can't monitor them 24/7.
But I think it's also talking about it. Don't just demonize it.
Right.
Just like, okay, kids that have chosen this path, what is their agenda? Or what are they running from? What
Mhm.
are they chasing? And it's like asking the kid, do you have something you're chasing after? Is that the right path? Do you have an agenda in taking these drugs? Do you want to become a drug dealer? Empowering the kids to actually look at what it is and make that choice for themselves, not that out of the fear of God or the
Right.
fear of this or the fear of that, because that very often can push them in that way. But, educating them into a point with an open dialogue
Mhm.
of where it goes, and that every drink you take or every drug you take, this is the potential path you could go down to the part that you are no longer in control.
Right.
Right? Do you want to go down that path? Empower the kids to be able to make that choice, not out of fear because of what the parents or society would do, but out of, I don't want that for my future.
Right. Yep.
So, I mean, everything comes down to choice. The choice of my body, my mind is not right. I need to go and find a doctor. And sometimes, yes, just like you shop around for a car, for a house, for this or that, you may have to shop around for a doctor. And, here now with today's show, you've got somebody who's dedicated his life to this. This is his research. And the reason he's doing it not only to help the patients, but help their patients. So it isn't about, oh, this is mine and only you can come to me and nobody else is going to do it. This isn't about the ego. And we do have doctors with ego. This is about how do I empower other doctors to treat patients in the way I'm treating patients and getting those positive results.
I can only see so many people. I'm pretty busy in my
Mm,
practice, and the reason I wrote these books is I realized like I can't help people like out of my area too much. Well,
right.
I do a lot. Like I said, a lot of people I have out of state and that talk to me on the phone or we do Zoom. But I can only help so many people, and that's why I feel compelled to try to help doctors help their patients,
Yeah.
and that's where I think
That's the ripple effect, right?
yeah, and I think
Right.
I can make a bigger difference by doing that.
Yeah.
Um,
Excellent. And
so,
that's the important thing is again, when you're aware, you care, and you do something about it. And this way, you are aware that there are options to your problem. A lot of people think fibromyalgia isn't a mental problem, right? And it's like, yeah, the wiring is wrong. I always say my wiring is wrong. Good sturdy car, but my wiring is wrong, right? And
when people say mental, people think, well, it's just mental. Well,
yes,
when I ask them, when I say that, I go, what do you mean mental? Well, it's just, I go, do you mean the brain? Isn't that like an organ, like a pretty important organ in your body? So
mhm.
the brain is mental, and because that's what we're referring to. So when people use these words mental, they're kind of thinking like, oh, it's just like made up. I'm making it up somehow, and
Or
that,
you means you're psychotic, or you're
or
bipolar, or you're this, or you're that, or that. Yeah, it's
you're
not just,
calling me crazy. Am I psycho? Am I
yeah, yeah.
like, no, you're not crazy. You're not psycho. You have an imbalance, and it's a mental problem because yes, it's your brain, and your brain's out of balance, and I can help you fix that, and pretty easily and pretty and safely and effectively if you just kind of work with me and a lot of people just again they have to get past the whole anti-pharmaceutical thing. Now,
Hmm.
and I tell people, a little bit funny, but I tell people sometimes a new patient will say, okay, here's my rules. Okay. There's three places you never want to get medical information from. Okay. Number one's the internet.
Hmm.
You don't go there. I said, there's a lot
Dr. Goodle.
of go down rabbit holes. You're going to see all these anti-pharmaceutical stuff. You're going to see, these people, these influence people. I said, it's just a bad place. You're going to see all these scary things, all these government warnings, all that. I said, so bad. The internet's worse. Number two, family and friends. And people chuckle about that. I go, well, think about it. Would you really want to get medical advice from a non-medical person? No. So family and friends. And number three is pharmacists. Why pharmacy? Because they're not clinicians. They
Mm,
know medication, but they don't understand the application of them. They don't
mm,
prescribe them. And so then they give you these handouts when you go in that has these like scary things. I tell people those things they give you, just throw them away. That you can see all that on the internet if you want. So just throw it away. If you want to get your medical advice, get it from the doctor you trust. I'll tell you the ins and outs. I'll tell you the side effects to look for. I'll tell you what would make you want to stop it and call me. Why, or so I can give them the real deal and the real things. And but but if they start going down the rabbit hole of trying to look into it themselves, it's just a bad road to go down because then they don't trust me and they go, well, he didn't say this. Well, I
yeah.
didn't say this because it's not true. It's not true in
Mm,
your case. And well, why didn't you tell me about the suicidal warning? I go, because it's not going to cause suicidal. It's going to help your depression.
mm,
It's going to decrease suicidal thinking. So all this stuff that they're going to read about and get misinformed about, it's just a bad road to go down. And it can be dangerous and sometimes even fatal.
Just another one that just came to mind was an awful lot of people, talk about corona fog from the coronavirus, or, people are getting fog brain. We see so much incline of dementia and everything today, which is a brain thing.
Mhm.
Is it because if they went on different medications, we might slow the process down or prevent the process?
Yeah. Let's ask the question again. I'm sorry.
About dementia, and brain fog, and and like brain farts, as we call them, a type of thing. It's less that memory type of thing where we haven't got the clarity, and we're seeing so many more people with dementia today that I don't know if we were more aware of it. But is this an imbalance in the brain, or is it something that could be prevented?
I personally think so. I mean, the research shows that we're not really sure what causes dementia, but I think so. And there's a condition called pseudo dementia. Now, pseudo means false or fake. So the pseudo dementia means people who have severe depression, who basically it's to the point where it affects their memory. And so there's a lot of people who can benefit from medications who are having dementia, and it can help them pull out of it, or at least reduce it quite a bit. So yeah, I think there is definitely a link between that and neurochemical issues.
When we always say if you don't use it, you lose it. So, and the other thing we've got to remember, the brain is the message center for the rest of the body,
Right,
right? So if your body's in distress, it means your brain is in distress, right? And like when you hurt yourself, oh, I hit my arm, I hurt myself, your
right,
brain feels it,
right.
right? So, we've got to understand we need to look after this noggin and help it be in balance, be able to send the right messaging through the body, keep our equilibrium, and then we will actually be able to pay attention to our body, because the brain has got the balance there.
Right. Yep, I agree.
So it's all there. It's just getting that balance in there, right? And that's what I keep saying with my thing, and I keep trying to describe it to doctors and to people. It's like I need to switch off the frequency because there's a frequency going constantly through my body, and it's like I need to turn the volume down it, or I need to switch it off.
Yep.
And it's like, but from where or how? That's always been the big question. And knowing that there is hope. The amount of people with fibromyalgia today, I don't know if it was just something never recognized before, or whether it's its own little pandemic, because so many people do have it. And the frustration to do with it is trying to explain to people what it is you have and what you're suffering with, but also with doctors that just don't know what to do with it.
Well, and what they'll do is they'll check blood tests. So they'll check for rheumatoid arthritis, they'll check for
Mm,
autoimmune disease, they'll check for lupus. So they'll do a bunch of blood tests to see if there's something that they can diagnose with the blood. But most of the time, all those tests come out normal, and then you're left with well, now what it is? Oh, we're going to label it fibromyalgia, and because there's no test for it, and it doesn't
yeah.
matter urine test, blood test, brain test, this that, and nothing shows that because it's a microscopic issue. And so yeah, so the basically the test is treating it. So in other,
Yes.
if I treat it correctly and the symptoms go away and improve, then they pass the test. So the test is the treatment. And it's because if I'm
Mm,
right about the chemicals that are off balance, the medication will work. If I'm not right, then it won't work. And then I have to back up and say, okay, well, it's not that. Maybe it's this, and then I have to try this, and let's see if that does it. And so there's a little bit of trial and error, but I call it rational trial and error. Right? It's not like throwing a dart at a dartboard it's really a rational basis of everything what I do. And my methods, again, it's very efficient because like a rule in psychiatry is, oh, it takes everything like an SSRI. You got to wait 4, 6, 8 weeks for it to work. Nonsense. Nothing takes that long to work. If you pick the right medication, it should work within a week, at 2 at the most. And so what I do is I work very quickly. I'm a very aggressive with what I do. I do something, I change it right away. I have the people contact me. I add this. So I'm doing things very, very quickly. And because if you wait months and months and months to get people better, a lot of them will drop out of treatment and say, well, forget it. It's not working for me. It's taking too long. And then you lose that patient. And you lose that patient may never try it again. So you basically doom that patient to a lifelong of suffering because you didn't do it right. So if with communicating with them and keeping in constant contact with me, and that's why I work so quickly, because I know what I'm doing and I know what to add, but based on their symptoms, based on so in other words, if someone says, oh, whatever you gave me, I'm 50% better. Oh, that's great. Okay, what's the other 50%? Well, I'm still tired. I'm still low motivation. I'm still a bit depressed. My anxiety is better. My fibro is better. All right, let's add some Wellbutrin, and that's boost dopamine. Okay, now that's better. My pain isn't completely gone. Okay, let's add Topamax. Let's add gabapentin. So I'm working extremely quickly because I want people to have hope. And when they start seeing quick results, that then they have hope that, oh my gosh, I am getting better. And they're actually and then they don't drop out of treatment, because then now they want to stay with me, because it's like, okay, keep doing what you're doing. Whatever you're doing is working for me.
Right. And that's what we want. We want things to work for us. It's like a sentence when you get these things. So I'm sorry, there's no cure for it. It's just manage it. I
Right.
don't know what to give you for this, that, etc. And it's just like it feels like a sentence.
Right.
Right. I can't get on the ground with my grandkids. I can't run. I
Right.
live in pain all the time. And it's like, surely there must be an answer. And
Right.
I think there's so many people, not just with fibro, but with other conditions, that are going, but I just don't know where to turn. And there's got to be an answer. And a lot of it is the doctors don't know. And
Mhm.
also they've been made to feel, well, it's all in your head. Yeah, it is. It's in the brain. So what are you going to do about it?
There's two things. Either is it mental or is it in my head? And it's
Yeah.
like the same question is like, now I'll ask them, I say, what's in your head? And they look at me, what do you mean? And I go, well, what is in your head?
Mhm.
My brain? I go, yeah, pretty,
You're
pretty,
right.
pretty important organ, don't you think?
Yes.
I would argue the most important one. Maybe you throw the heart up there. That's pretty important too. But yeah, those are probably the two most important ones: the brain and the heart. And yeah, so it is in your head, but not in the way you're asking me. And
Yeah.
but then then they get it. They go, oh, no, okay, now that makes more sense. And what I do with every patient is I draw neurons. I draw and I explain, okay, this is what I'm doing with this medication. I'm rebalancing these two, and I'm doing. So I show them exactly what I'm doing on paper, because there's no blood, since there's no blood test. Looking at it on paper is very powerful, because they see like, oh, there's a reason, there's a rational reason why he's doing.
Identification of the problem. Yes.
They see that, and it makes sense. That's why I do that on my TV show. I have a whiteboard that after every patient, I go to the whiteboard and I say, okay, here's what's happening with this person. I did this, I did that, and so I'm teaching people on my show what I'm doing and why I'm making the decisions.
And that's something very powerful. It's not, well, just take a drug and call me in the morning type of thing. It's like, this is why it works, or this is why we need to add this. So this is why, the balance of that would make this more optimizing. And it's like, we're more inclined to experiment and take other things if we have a reason and understanding behind it. But,
Yeah.
half the time we feel that we just, got darts being thrown at us and hope that it hits. And it's like, I know there's a lot of pressure on doctors to know what to know. But at the same time, I do wish doctors would do a bit more research, but you've done that for them. And this is the whole point.
And it basically, research has been trying to figure it out, but my research has been in my office.
Yeah.
My research has been, so I call it we talk about clinical trials. Well, I've done clinical trials. Well, people say, oh, do you work for a pharmaceutical company and do clinical trials for them? No, I do clinical trials in my office. It's
Hmm.
even better, because I'm looking at the clinical trials in real time, and seeing what I'm doing in real time. So it's way better than a pharmaceutical clinical trial, because then you have patients on placebo, they're getting nothing. You have patients
Hmm.
on this, and they have to do studies like that to get it approved. And so yeah, so this then my clinical trials are based on experience and doing it over and over and over again. And there's a book out. I don't know if you've heard of Malcolm Gladwell. He's an author, but he basically in one of his books, I can't remember which one it is, but he basically says to become an expert on something, you have to do 10,000 hours of it to become an expert.
Mm. Hmm.
Well, I've done about 60,000 hours of what I do in my career. So have I become an expert? Yeah, but I've become an expert because of doing it so much,
Hmm.
and looking at every tiny little detail, and you got to look at family history very closely. You got to look at every detail. What I do from patients is I start from the beginning. I look, tell me about your childhood growing up, and tell me about your adolescence. Tell me about your teens. Tell me about your 20s. And so I tell them to walk me through your life. And then I ask them, when did you feel your best in your life? And then most of the answers are going to be either elementary school, because that's when you play, you're out with your friends, you don't really have a lot of worries in the world. Now this is if you have a functional childhood and your parents aren't abusive, or you're not,
Hmm.
so if it's a happy time. And then the other time people will say it'd be like late teens, early mid 20s. Why? Because out of school, maybe you go on to university, maybe not. You start your career before family and before marriage and kids, which is great. I got two kids, but it's more stressful in life. It makes life more
Hmm.
stressful. So when they tell me that, I note that in the chart. And then in future visits, I say, okay, you told me a couple of visits ago, you felt best here. Are you there? And they go, I'm pretty close. I go, how close? I'm about 85%. Okay, good. What's the other 15%?
Right.
I'm always pushing, and they go, well, my sleep could be a bit better, my that. Okay, let's work on that now. Am I going to get them to 100%? Not every time, but if I can get them to 90, 95%, that's pretty good. And so that's my measure of things, is by taking a really good history and finding out their past, and then seeing what the patterns have been over the years with them, and what have you taken, what hasn't worked, what has helped, and all those things. All those details are super important, which is why I have to spend a lot of time with people, and I do a lot of listening. I'm a really good listener, because listening is the only way to do this, because doctors love to talk, but we're not great listeners.
Right.
And so you have to be a really good listener to do what I do. You have to really connect and be empathic with people, because you have to understand their feelings, and you have to really get deep into their emotions, and that can be a heavy thing to hear and over again.
Yes. Yeah, exactly. So you've got to do something for yourself to download and release. But in a lot of ways, you're not doing theory, you're doing practice, right? And it's the practicum. In any career, we learn the theory, and then it's the practicum of applying the theory. So you kind of almost mix the theory and the practicum together. To see, and the results have spoken for themselves. They've become the truth. And the fact that you do listen is essential, because very often a patient doesn't know,
Right,
when did it start, when did it this, when did it that, and it's like, you want my history, but I can't tell you when this began or when that is, just something that's crept up on me, or something that has become, and you
right,
don't know what the root is. And so somebody asking you the right questions. Ah, yes. Oh, right. Oh, yeah.
right,
I didn't feel that, or did feel that then, and then you've got the right information, but so have we, because
right,
half the time we don't quite know. We just know we're in pain, and that's
right.
it, right?
So,
So it's having somebody that and empathic doctor is that it's not so much you're feeling the pain, but you are feeling the pain, right? So you're feeling the emotional pain.
and for myself, I walk every morning, about 3 miles every morning, power walk. So that's why, with what I do, and since I'm so busy with writing and the show and the practice, I have to, I got to keep up with my exercise. I try to eat well. I try to keep my weight under control. So I'm always, also doing self-care, because, to do what I've done, and,
Yeah.
it's been tough. It has not been an easy journey for me. And in my new book, I talk about my story in section 5 of the book. And in section 6, I talk about some of the struggles I've had in my career, in my life.
Hmm.
And so it's been tough at times. And I am very honest about what I've gone through myself. And like I said, and in my triumph and how I've gotten through them. And I wrote a lot of that stuff, personal stuff, to be inspirational to people. Like, oh, that the guy who's doing all this, even he's gone through some struggles, and he's
Exactly.
so that's why
He relates. He
I,
relates, right? And he's relatable, right? Yeah.
oh, I understand it. Yeah. And
Yeah. And there's a place for clinical doctors. I mean, a brain surgeon, I do not want them to know, but also at the same time, I'd like them to have their own little instincts, their own intuition, and go, maybe I shouldn't slice there.
right,
It's just because science and, it's, the drawing says there, but my instincts say here that you to be so in tune with the instincts
right,
and the science and the wisdom,
right,
that's that knowledge and that intuition creates the wisdom, right? And when you've got somebody that's coming from that place of wisdom, is because they're using both,
yep.
right? Otherwise, knowledge is data. The wisdom is knowing actually how to use that data intuitively. So that's important. But this has been absolutely great. So now, where do people find your book? How do they find you? Give us your website and your Facebook, LinkedIn, and Instagram.
So yeah, Facebook. I'm having struggled with. There's something technically wrong with my account, so I'm not using Facebook a lot. I'm on X, which was Twitter. I'm on Instagram. I'm on TikTok. My website is www.doctor is drpaulcoronamd.com, but it's DR for doctor. So DR, no period. So DR Paul Corona, MD for medical doctor.com. And on my website, there's a lot of stuff on there. There's my there's testimonials, there's my background, my training, all that. And my books are all available. Link to the where you can get them. And so my first 3 books, Healing the Mind and Body, the trilogy, there's a 3-book series that's available on Amazon. My newest book, The Corona Protocol, is available on Amazon, Barnes and Noble, and Walmart. We also I did an audio book, so that's on Audible if you want to get the audio book. And my TV show I already talked about, and that's doing really really well. And so that's how you can get a hold of me. And again, if you want to become a patient, just contact my office and we can make that happen.
And a corona is Corona,
Like,
folks. So the
just like
Corona Protocol,
yeah,
to make sure that you know that. And, this is the thing, you've dedicated your life to this. And everybody has what I call an instrument to, that self-discovery. What is my instrument? How do I use it? Which orchestra do I use it with? Well, your instrument and the research that you've done, you've now become the conductor of the orchestra. All
yep,
right, and you can help that orchestra learn the music and play it harmoniously together, which is what we are needing in life. We need to be able to collaborate cohesively, listen to one another, and as you said, this is what I've discovered through 30 years. Now you open up to other doctors and go, oh, have you tried this or have you tried that? Or come back to you and say, I use that, but then in conjunction, I use that. And so that one constant display of knowledge is only empowering the doctors so they can empower the patients. And that's ultimately what it is. So leave ego at the door, folks, and leave doubt at the door, right? And be willing as a patient to explore, what will work for you. You've tried everything, and
right.
it's all about balance. Everything in life is about balance. And if you're having problems physically or mentally, it's because something's out of balance. So
What do
what's
you
going to give it back?
what do you have to lose?
Yeah,
people who are hesitant, I'm just not going to go down the road of medication. You know what? If you're stuck there, there's no way I can help you. But
right.
let's give it a shot. You have nothing to lose. You got a lot to gain potentially, and there's really nothing to lose because you can always, if you don't like them, you stop them.
Right.
So it's not a big deal. But if I can show you that this that how they work and why they work, and why not? Why not feel better? There's when it's right there available to you. What's the point of suffering when you don't have to?
Exactly. And the thing is, you may have heard something bad, but there's always something good. And let's face it, media loves to emphasize the bad and not the good. And until you are willing to try it out for yourself, you're not an expert on it. Right. So it's if you're really, life is about choice. Do you want to stay in pain? You as a doctor, do you want to serve your patients? Do you want to know how to empower each other, doctor and patient? Because when we're not in pain anymore, we're more productive. We're more contributors to society and not coming from a place of just crippling. And we need to decripple people from their diseases. And let's start with the brain, because that's where it does start. So thank you so much for sharing here today, Paul. It's been absolutely great. And I certainly need to talk to you. But it's most certainly is something that there's always an answer, always an answer. They say God gives you a disease and a few feet away is the solution. And, they have the cure for it. And it's a question of, are we asking the right questions? All right. And that's where it all starts. So thank you so much for being here today.
They're great.
Until next time, folks, remember, there's always an answer. There's always a way to heal yourself. You've just got to be willing to explore. So until next time, bye for now. We hope that you enjoyed the show. There are so many more for you here on selfdiscoverywisdom.com. Just go to the podcast tag at the top there and you will see all the many genres and all 3,000 shows ready for your listening. We are here to serve you, to help you on your journey of life. And we know that through inspiration, it begets invitation. We are supported by you, the listeners, and those that we interview. Anything that you can spare us in donation would be greatly accepted. And we do hope that you enjoy the next show.